Hi, I'm Dr. Rahi Victory, obstetrician gynecologist and reproductive endocrinology and infertility expert. Today, we're going to talk to you about the safety and efficacy of the booster dose for the COVID-19 vaccines if you are pregnant or trying to conceive. So many of you have hopefully seen our previous videos on the COVID-19 vaccines and their safety in pregnancy. If you haven't checked them out, you can click right there, and that's our button to get you linked to those videos. If you haven't seen them, make sure you subscribe and hit the like button on those videos for us. The booster dose is the exact same dose as the other doses that you've already received, in particular if you're receiving Moderna or Pfizer. There is no biological difference in the booster dose. It's the same vaccine and it has the same ingredients and components to it. The question becomes, is it safe? We now have multiple studies that have all demonstrated absolute safety of the vaccines in pregnancy and for those that are trying to conceive. So there is no reason to avoid getting the vaccine. People were worried about miscarriages. They've done multiple studies now, including one with over 108,000 patients in it, all showing that there is no relationship of being vaccinated to your chance of a miscarriage. In terms of the actual pregnancy outcomes, there is no difference in pregnancy outcomes for patients that were vaccinated versus the unvaccinated, except that if you do actually contract COVID virus while pregnant without being vaccinated, your risks of virtually every single complication of pregnancy are drastically increased, including a terrifying 22.3-fold increased risk of death. So the vaccines are safe and they are effective. Does the booster have any significant difference? No. What we've learned so far is that the immunity to the COVID-19 virus starts to wane or decrease after approximately 6 months from the last shot of the vaccine. And so this really is no different than getting a booster shot or a repeat vaccination like you would for the flu shot, also highly recommended for pregnant patients every year. Well, instead of every year, you need one every 6 months right now with COVID. Is it going to cause a problem for your ovaries or for your baby? No, that has all been debunked. It was complete nonsense and there wasn't a speck of truth to any of that. So there are no complications for fetuses or for the pregnancies or the outcomes. There have been no studies demonstrating any increased risk of adverse outcomes. ACOG, SOGC, virtually every society out there, including the Society for Maternal Fetal Medicine, have all supported the use of the vaccines in pregnant women, including now the booster doses. And for those who are immunocompromised, it is even more important to get these. So make sure that you are getting vaccinated. Now, some of you who have watched our videos know that we tend to be a little bit hesitant in vaccinating around the time of an embryo transfer, and I do want to briefly touch on that for you. If you are undergoing an embryo transfer for IVF, the reality is that the vaccine will activate your immune system. And there are many studies that have shown that an overactive immune system can interfere with embryo implantation. So what we want you to do is get vaccinated first and then do your embryo transfer. Don't worry about it the other way around. We don't want you getting pregnant first and then worrying about the vaccine. However, if you have done an embryo transfer recently and are due for your booster, waiting until you see a positive fetal heartbeat is time enough to allow for you to then get vaccinated with no risk of miscarriage or complications in the pregnancy. Hope you've enjoyed that video and found it informative. We've got loads of videos on our YouTube channel. Go to youtube.com/drvictory and hit that subscribe button.